Welcome and thank you for being here today. This training is the disease concept of addiction or addiction as a disease. And so throughout today's course, we're going to explore how addiction functions as a chronic, progressive, and treatable disease that affects the brain and behavior and just really the overall functioning of people. And as addiction counselors, it's essential that we understand not only the behavioral symptoms of addiction, but also the biological and neurological changes that happen in the brain as the substance use is progressing. And we're going to examine addiction through the disease model. We want to explore the neurobiology behind substance use disorders, discuss risk factors, and we want to look at how this knowledge is informing our clinical assessments and treatment planning, and also relapse prevention. So before we begin, I just want to briefly introduce myself. My name is Desiree Cochran-Norfolk. I am a certified clinical supervisor and certified master addiction counselor and a certified addiction counselor level 2 through the Georgia Addiction Counselors Association. I'm also a substance abuse professional through NADAC, along with other specialty credentials. Through the Georgia Reentry Center, I work with individuals involved in the criminal justice system, people struggling with substance use disorders, professionals seeking training in behavioral health and addiction counseling. And a large part of my work involves assessing addiction and providing treatment services and training counselors. So the topic of addiction as a disease is something that I apply in my clinical practice every day. And today's training is designed to strengthen your understanding of addiction so that you can better serve your clients and their families and the communities that are affected by substance use disorders. So the primary goal of this course is to strengthen your understanding of addiction as a chronic and treatable disease, and to help you apply this knowledge in real clinical settings. So throughout the training, we're going to focus on several key areas. First, we're going to look at what it means to define addiction as a disease rather than just simply viewing it as a behavioral problem. Then we're going to explore the neurobiology of addiction. We want to look at how the substances are affecting brain chemistry and decision making. We also want to examine risk factors, including biological, psychological, and social influences. And then finally, we want to discuss how the disease model can be used in assessment and treatment planning, and also relapse prevention and client education. And by the end of this course, you should be able to clearly explain the disease concept of addiction, including its chronic, progressive, and relapsing nature. You're also going to be able to describe how substance use alters brain structure and brain functioning, particularly the areas that are responsible for reward, motivation, and decision making. Another important objective for this training is to identify the biological, psychological, and social factors that are contributing to addiction. We're also going to discuss how to challenge the misconceptions that addiction is just simply a moral failure or a lack of willpower. And then finally, you should be able to apply the disease model to treatment planning and client education, helping individuals and family better understand addiction and recovery. So we know that addiction is far more complex than just simply using substances. Clinically, addiction is characterized by compulsive substance use or a loss of control and a continued use despite harmful consequences. People may continue using substances even when they experience serious problems like legal issues or health problems, relationship conflicts, job loss, what have you. And so addiction is going to also affect multiple areas of functioning, including thinking and behavior, emotional regulation, and your physical health. And the research out there has shown that addiction does involve changes in brain chemistry, particularly in the areas that are responsible for reward, motivation, and impulse control. And because of the neurological changes, addiction cannot simply just be resolved through willpower alone. So it's not a willpower problem. But historically, addiction was often viewed through that moral or criminal lens. People struggling with substance use were frequently labeled as weak or immoral or lacking discipline. And for a lot of years, society believed people simply just needed to try harder or make better choices. But advances in neuroscience and behavioral health research have dramatically changed how we understand addiction. And so today, addiction is widely recognized as a chronic brain disease, and it involves biological, psychological, and social factors. And so this shift in perspective has significantly influenced treatment approaches, public health policies, and counseling practices. If you want to read more about this, William White has a book called Recovery Rising. It's a great historical account of how the addiction field has kind of transformed over the years, and it talks a lot about how this has happened. Another person that you can look into is the leader of NIDA. I'm sorry, not the leader of NIDA. She's a head scientist at NIDA, Dr. Nora Volkow. She's got a lot of great videos on YouTube that you can look up. So the disease model of addiction, it really describes addiction as having several important characteristics. First, addiction is chronic, which means that it often requires long-term management rather than just a one-time cure. Second, addiction is progressive. It means that it tends to worsen over time if we leave it untreated. And then third, addiction is relapsing, meaning that individuals may return to substance use after periods of recovery. But relapse doesn't just mean that the treatment has failed. Instead, it's often part of the recovery process. But we know that addiction is treatable. A lot of people achieve long-term recovery with the appropriate support and treatment. And so this model is similar to the other chronic health conditions like diabetes or hypertension, and those also require ongoing care and lifestyle management. I call them all lifestyle diseases. Your lifestyle contributed to getting the disease, but once you have it, you got it forever. And so this disease model, it's important for a couple of reasons, especially in people working in behavioral health, because this model reduces stigma. It kind of shifts the conversation away from blame and toward understanding. And then it also encourages compassion and empathy. Those are essential components of effective counseling. And understanding addiction as a disease is going to improve our treatment planning because the interventions can address the biological and the psychological and the social factors. And it also helps the clients to understand that recovery is a process that's requiring ongoing support and management rather than just a simple decision to stop using substances one time. So before we move forward, I just kind of want to take a few minutes for you to think about this. Think about the messages that you've heard about addiction growing up. A lot of us were taught that addiction was just simply a bad choice or a character flaw. They just need Jesus. But we want to consider how those beliefs might influence the way people view other people with substance use disorders. And then I want you to think about how the disease model changes that perspective. Understanding addiction as a medical and a psychological condition can shift our focus from blame to treatment and recovery and support.